planning reinforces people's right to determine the number and the spacing of children they wish to have. Family planning could also affect a woman's health, especially when the woman has had so many children. On today's episode of Health Watch, our doctor will be telling us the modern methods of family planning, the side effects of each of this family planning, and of course, advising the women on what works for them. That is, the women should go for what works for them. Plus, on Aurora Reproductive Healthcare segments, our doctor, Dr. Eddie Osage, the medical director, will be talking on fertility this week. My name is Nkem Okibe. We'll go on a short break. When we return, you'll meet my guests. Stay with us. If you're just joining us, the program is Health Watch, reaching you on NTA Lagos Channel 10, the station for excellence. Today's topic is an interesting one. It's not a topic for women alone. It's a topic for the family, because for a woman to have a child, of course, she needs her husband, of course, she needs her partner to have a baby. Today's episode, we have an interesting doctor, someone that has had experience of working with women. His name is Dr. Ime Akpan. He's a family physician. You're welcome to Health Watch.
Thank you very much.
Talking about family planning, yes, of course, just like the name implies, you have planner and you have family, so it means you're planning the kind of family or the size of family you wish to have. But I'd like to talk about the modern methods of family planning.
Thank you. Let's say, like you've mentioned, family planning is not actually something that is new. Many thousands of years ago, men and women have gone into one form of family planning or the other. I guess today we want to talk about modern methods of family planning. As you've also mentioned, you're talking about planning in the family, and most people think that it involves the women only, but no, it's something that involves both the man, the woman, and sometimes even relations, especially because of where we are. So it is a plan, to decide when and maybe even where either to have or not to have children, and I think that right stays with the family, and they decide how it should be. Let me quickly say that in our country, some time ago, there was maybe a legislation that said, talk about 4 children per family, but then it became very unclear whether it was 4 children per woman or 4 children per entire family. And I remember then that there were controversies, because those certain men that would marry up to 10 wives.
Oh, sure, there'll be controversies, especially, sorry to cut in, but especially when you have this male issue where a woman has had like four children, but 4 female children. Yes. You know how it is in this climb, yes, where the husband is also worried, I don't have a son yet. Yes. So either to make a law like that, we know that the consequences won't be good enough. Yeah,
so I think, on that, I think our lawmakers will really have to sit down and fine-tune the laws so that it will be of benefit first to the people that are concerned. Okay. So thank you. So talking about modern family, planning methods, there are various things that could be considered, modern. But first of all, what we are after is, the safety of the clients who is taking the methods, and where to assess such methods. Those are things we want to talk about, and then we also would be able to say that these things are readily available, unlike what some people say. There are centers where healthcare professionals have been trained to offer services that are modern, things that when you take, it will not become detrimental, to your health. Okay. Dealing with modern facilities, maybe matters of classification, we can just place it broadly into 2 groups. The hormonal contraceptives, and then we want to talk about the barrier methods. Okay. maybe let me start from the second one, what we call the barrier methods. Those who deal with things such as the IUDs. We want to think about sterilization. We want to talk about the vasectomies, such things that we do, whereby it creates a barrier so that fertilization does not take place, so the children do not actually even come. And then the other one basically involves the ones that are chemical oriented, dealing with certain hormones. Those are the ones we talked about, the hormonal contraceptives. Maybe, like I said, on the barrier methods, let me quickly mention here that any professional, any provider would always need to counsel you properly before a decision is being taken on which methods to adopt. And the decision to take a method depends on the individual. The provider does not force it on you. It is your choice after you have been exposed to the advantages and disadvantages, maybe even the side effects, so that you can make an informed decision. Informed choice on what to take. Quickly, as I was mentioning, let me say from experience, I had a couple some years ago who said they've completed the number of children that they want, and we sat down and we spoke about it, signed consents and came into agreements. I took time to explain to them, and they said, "Oh, doctor, we want you," the way they say it, "we want you to make sure that my wife's tubes are tied. There should be no children again." And
your wife's tubes are tied?
Yeah, that we should tie the tubes. And,
what does that mean?
Yeah, that's what we call in medicine tubal ligation. The fallopian tubes, the tubes that carry the sperm and the egg where they meet and fertilize, so they can be tied, they can be cut off, they can be clipped, so that passage of sperm to meet the egg does not happen any longer. So I remember that event. We took some time, quite some time, over 2 months to discuss, and they still said they want to have that method done. And I told them that this method is irreversible. Once it is done, maybe we say with God nothing is impossible. It can only take God to reverse it. And they say they want it. And so after it was done, very unfortunately, calamity arose. They lost one of the children.
Wow.
And then he came back. What can we do? Couldn't you reverse? I said, but this is what we talked about. So I just want to say that such decisions are not decisions to be taken in a hurry. Somebody must have full understanding. So again, like I said, that for the man, barrier method could be what we talk about, what we call vasectomy. Vasectomy is also like tying the tubes for the man. Remembering that the man also, who produces the sperms are produced in the testes, and he has to travel along, and then during ejaculation comes out through the penis. So those tubes that carry, they carry the semen can also be tied, and that procedure is, by, a little surgery that is be done by specialists. So the man can subject himself to that, and that is still a form of modern family planning.
Can I quickly ask you a question?
Yes.
How many Nigerian men will be willing to do that?
Well, I may not be very accurate with the statistics, but it is a method that people are beginning to adopt because there is, an increasing education about it. People have come to ask of it here.
Okay, is it reversible?
That is not reversible. That's what I'm saying. That again, because once it is done, it's just like tying the human tubes. I was only just saying that is what the man can also decide. But then it's good because it doesn't disturb the man from having his sexual satisfaction. It is only that it does not bring forth semen. It's a good method, like I said, and younger people that are understanding are beginning to key into it. So we have that, and then again, we talk about the barrier. There are condoms. There are also, instrument that can be used, either as a diaphragm that when it is put inside the vagina of the woman, it completely occludes, it blocks so that nothing can go in. So whatever semen goes in there is just, you know, stays within the vagina, cannot enter into the womb through the cervix. So it's like a barrier, you know, it does not permit it to go. There are things that they call the cervical cap, like a little cup that is being put over the cervix, remembering that the entrance into the womb is from the cervix through a tiny opening that is called, you know, the cervical, you know, external and internal. So when it's capped over the cervix, nothing can go.
How long does this method last? Is it something you put at the time of meeting your partner, or does it stay for a longer time?
Yes, yes. Thank you for the question that you have asked. It is important that one would know that semen is not like a solid thing, you know. So when it is a person would need to at least allow time, you know, after this intercourse, allow little time before going to, you know, think of taking it off. So in the process, you don't even pour the thing back. Coming back to issues of, you know, the hormonals that I talked about, you know, most people talk about the pills. Most people talk about the injections, you know, and today again, like I said, even what we used to know as the copper tea and all, some of them also come with hormones added on it, you know.
All right, we'll take a short break. When we return, Doctor will be telling us about the side effects of some of these family planning methods. We'll be right back. If you're just joining us, the program is Health Watch, and today we're looking at family planning and the issues surrounding it. Before we went on that break, you talked about a lot of things. You talked about the methods from barrier to hormonal, and you talked about the fact that you have to use what you are convinced would work for you. Nobody's putting any kind of pressure on you. Now, the question is, for the ones you've mentioned some, and you've mentioned also the side effects. I'm sure that there's some that you've not mentioned, the side effects that comes with it. Particularly when we talk about the weight gain, and of course some people also have some kind of hair loss. I don't know what causes that, but tell us, what would you say is the most common method used in this part of the world, and the side effects that comes with it?
Yes, thank you. Before any method is given, your provider will ask you questions. We need to examine you, and then we look at what would be suitable. For instance, if a person will have some massive, you know, fibroids, you know, that the ultrasound has shown that they are, you know, both even inside the endometrial cavity and all, that candidate may not be, you know, a good candidate for the intrauterine device, considering that
is that the IUCD?
Yes, yes, the IUCD, because that could stimulate more bleeding. And that would not be an advantage, you know, But is this method, is it reversible, just in case? Yes, thank you for your question. Yes, these ones that I mentioned, the hormonal, the IUDs, they are completely reversible.
Okay. Thank you, Doctor, for coming on Health Watch. The topic we talked about today is a very broad one. We're not done yet. We'll call you very soon so that we can talk about some other issues affecting family planning. Thank you so much for coming.
Thank you very much. My pleasure. Thank you.
Moving on, Dr. Eddie Osagi, the Medical Director of Aurora Reproductive Health Care, is standing by to talk on fertility. That's our focus this week.
Hello, my name is Dr. Edmond Eddie Osagi. I'm a specialist gynecologist, and my specialist area is reproductive medicine and surgery. Today I'm going to speak to you about fertility. Fertility impacts on everybody. Everybody knows somebody who has struggled with their fertility or has had some issues with their fertility. And it unfortunately is one of those areas that people just choose not to talk about. And it's such a wide area that today I just want to focus on giving people information about how they can help themselves. So people who are trying to conceive, people who are planning to conceive, just a bit of information to just empower you in being more in control of your fertility. The first place I'll start from is that it takes two to make fertility happen. There's a contribution from a man and a contribution from a woman. And both partners have to be in good health. Both partners have to, as I say, the healthier you are, the more fertile you are. So if both partners are maintaining good level of exercise, their nutrition is excellent, they're maintaining a healthy balanced diet, they're taking their vitamins, then they're giving themselves a very good chance of achieving fertility. Exercise is important to keep us healthy, but it is also important to maintain our body mass index within a normal range. We recommend that people trying to get pregnant should maintain their body mass index within a range of 20 to 30, because body mass indices outside of those ranges can affect the function of the ovaries, where eggs are released in a woman, which are crucial for fertility, and they can affect the function of the testes, where sperm are formed in the man, which are also crucial for fertility. So it's really important that people maintain their body mass indices in those ranges. Now, what you take into your body can have a profound effect on your fertility. Not just what you eat, but what you drink as well. So one of the things people are not aware of is that excessive caffeine intake can impact negatively on fertility. So we do recommend that people watch the amount of caffeine they take, not just in things like tea and coffee, but also in things like carbonated drinks. So it's important that people keep those in mind. Also important are the medication you take. So anybody who takes non-prescription medication should be very, very careful about continuing with that when they're trying to get pregnant, because some of those things could be impacting negatively on the function of their fertility organs. So we do recommend that people who are trying to get pregnant or people who plan to start trying to get pregnant should review their medical needs and only be on medication that is prescribed by a specialist and treating a specific condition. If in any doubt, our recommendation is that they should go see a fertility specialist who will be able to give them what we call preconception advice. Alcohol is also a major factor when it comes to fertility. Excessive alcohol intake for both the male and the female can impact negatively on fertility, and our recommendation is not that people stop drinking completely, but that people take alcohol in moderation. We do not know what is excessive for fertility. We know what is excessive for general health, but the advice we give is that drinking minimal amounts is the best way when people are trying to get pregnant. Smoking is significantly detrimental to both male and female fertility because cigarette smoke contains loads of chemical toxins that damage the eggs in the ovaries and also damage sperm formation. And cannabis use especially is significantly detrimental to sperm formation. And our advice is that people who are trying to conceive should avoid using such medication. A particular drug I would advise men about is the use of anabolic steroids in gyms. There are a lot of men who are into bodybuilding and they use anabolic steroids to try and bulk up their muscles. Our experience within the fertility world is that those steroids are very detrimental to sperm formation, and we find a lot of men who use anabolic steroids who have no sperm at all. If you are in that situation, avoid use of anabolic steroids. Female age is probably one of the most important determinants of fertility. So for people who are trying to conceive, we always say the earlier you start, the better for you. But we know we live in a real world, and so not everybody is able to start trying to conceive early. Now, for anybody who's been trying to conceive for over a year and are having difficulty, our recommendation is that they go see a specialist, a fertility specialist, who'll be able to review all of their histories, who'll be able to look into all their attempts at conceiving and give them specific advice. Because again, if there are problems, they are best picked up at an early stage so that something can be done about them. And some of the common problems that we encounter are things like women not releasing an egg regularly, something called anovulation. And there are very simple measures we can put in place to help women to release their eggs to achieve conception. Sometimes there are subtle abnormalities with sperm that we pick up. And again, there are things we can do to try and optimize male sperm production, to try and overcome those issues. Ultimately, if there are profound issues that we cannot overcome in that way, or if we've tried some of these measures and they haven't worked, then we'll fall back on IVF treatment, which a lot of people know about. IVF has become almost a mainstay of fertility treatment now, and it's such a safe way for people to have their children, and it's readily available and affordable. My advice is that people should consider seeking help early, okay? So anybody who knows that they've got a problem, like women who have irregular periods, that will tell you that it's likely that you're not ovulating. When you get to the point where you're trying to conceive, go see a specialist. Talk to them about your irregular periods. And it's best to be on medication to correct that anovulation before you waste a lot of time. Get some tests done, find out why you've not been able to conceive. And if there are simple measures that can be put in place to help you, they will be put in place. If things are more profound than that, or if those simple measures do not work, then it's best to move on to things like IVF treatment at an early stage. And as I said, IVF is readily available, it's a safe way of having treatment. Now, for people who are trying to get pregnant and are having difficulty, if they come and see a specialist like me, there's some basic tests we do as well. So we do tests on the female to find out what their ovarian reserve is. So we do a blood test that will give us an idea of how many eggs women have left in their ovaries, or will give us an idea of whether this woman is ovulating, releasing an egg every month. We can do a dye test to check the tubes in women, okay? And that's a very straightforward outpatient investigation we do. And that gives us information about the whether the tubes, the passage for the sperm and egg to meet are clear. We'll normally undertake an ultrasound scan as well to check the woman's female pelvic organs, because there are things that can give rise to subfertility that can affect the female pelvic organs, such as fibroids, such as endometriosis. And if we pick those up on ultrasound, then we can discuss with the couple how we manage those situations for them. We'll do a semen analysis on the male, because as I said earlier, it takes two to make fertility happen. So everything cannot be on one side. And we do know that men contribute about 40% to the burden of fertility. So it's important that we find out what's happening with the sperm in a man. And there are three things we look for in the sperm. We look for the number of sperm, how well the sperm move, and the shape of the sperm. And all three things have to be working fine for that sperm to be of optimal fertility. Once we get all those results back, then we'll be in a position to sit the couple down, to talk to them about what the problems are and what treatments are available for them. Once again, my name is Dr. Eddie Osage. I'm a specialist gynecologist.
And that's the much you can take on this week's episode of Health Watch. Remember that health-conscious people live longer. Family planning is not just about the woman, it's for the woman and her partner, or the woman and her husband. We must all come together to take decisions that will help us and that will help our children, and of course that will help the society at large. Send us a mail to okibeinkem@gmail.com, healthwatchNTA10@gmail.com, or send a text only to 070 608-654-87. My name is Nkem Okibe. See you next week. Bye.